Hey, it's Dr. Kimberly L Evans from Sugarland Medical Spa. Today I'm going to be talking to you about something that's called the Women's Wellness Exam. I'm a board certified OBGYN doctor. I have nearly 20 years of experience, so I've done a lot of these. So I actually just want to take a few minutes today just to kind of let you know about what is the Women's Wellness Exam. I do have a little medical disclaimer because certainly you want to talk to your doctor about everything as far as medical advice goes. However, I did just want to get into, because I'm asked a lot, like, what exactly is this? What exactly is this for? You know, how long do I need to do this for? Things like that. So I just want to briefly tell you about what it is. So when we talk about what a women's wellness exam is, ACOG, which is the American College of Obstetrics and Gynecology, they defined it as an excellent opportunity to counsel patients about maintaining a healthy lifestyle and minimizing health risks, which is, I think, perfect. This is something that should also include screening, evaluation, and counseling, as well as potential for immunizations, if your doctor provides that, based on your age as well as other risk factors. So do know that every woman is different. So if you have a patient that's coming in for a well woman exam at 18 years old, we don't start doing pap smear screening yet, but we are more concerned with age-appropriate things such as STD screening. Versus if you have someone coming in at 44 years old that's bleeding, we'll certainly be worried about different things along with her well woman exam to be able to address those issues. So again, knowing which key elements are, it's going to vary depending on from patient to patient, as well as from doctor to doctor. However, for us, what is a well woman exam? It has to do with taking your history, doing things like your basic physical exam, as well as additional screening tests. Like I mentioned, the young person, we're very concerned with making sure there's no infectious processes that are going on, as well as making sure that if she wanted to talk about birth control and get something started, we would be able to provide that for her. We also do things like a breast exam, again, age appropriate, pap smear screening, HIV screening, and I already mentioned things such as the STD screening, as well as additional blood work can also be done. Birth control counseling, I already mentioned that, as well as any recommendations on follow-up. So such as if I mentioned the 40-year-old lady with a lot of heavy bleeding and she came in for a well woman exam, certainly we want to say, hey, we need to make sure that we bring you back so we can talk about additional risk factors that you may have, as well as blood tests that we may order. It may consist of things such as checking for things like anemia or thyroid disease. Those are common things that can actually lead to heavy bleeding. So when we talk about what is a breast exam, because some women are very nervous, like, oh my goodness, what is this? What do I do? What does it look like? So I actually included a great diagram. This, of course, breast tissue. Notice that there's a breast tissue that's here, the nipple area, as well as lymph nodes that actually drain here. So when we do your breast exam, the first thing that your doctor may do is that we're going to be inspecting the breast. We're going to be looking for things like abnormal skin, any sort of nipple retraction, something that's not the same on the other side. So do know that breast tissue is like faces. So just like two sides of your face can be different from either side, so can each breast. Sometimes one may be a little elevated, sometimes may be a little lower. They can actually point outwards. It's going to vary from patient to patient, but we look for that symmetry or that kind of common feeling of the breast tissue to know that that tissue is okay. So again, after looking also to make sure there's no discharge, we're going to actually palpate the area. I'm someone, I actually feel underneath the armpits. The reason for that is because there's lymph node tissue that's there, such that if there was any cancer that was draining in that area, you can actually feel enlargements there too. So even when you do your own breast exam, this is something also that you may also be feeling for underneath there. Other things to look for, things like tenderness, things like abnormal masses, abnormal lymph nodes underneath here. Those are all important elements that we look for in the breast exam, okay? And again, we would do that on both breasts. So the other thing that we look for is the pelvic exam. And some people are very, very squeamish about this, but please don't be. This is the one time in your life where you can sit down and talk to somebody and say, hey, this isn't normal, or I have an abnormal discharge, or I have a weird pain during intercourse. This is your time to review with your doctor, like, hey, do my pelvic exam and also tell me, does everything feel normal? Does everything look normal? As well as, again, addressing those, those common questions. So, do take advantage of this time, because certainly you can definitely identify things that should not be there, okay? So when we talk about your pelvic exam, certainly we're looking for anything that's wrong. We look on the outside here. Sometimes there can be things like melanomas or abnormal moles, pre-invasive cancers that you can just, that guess because I've been doing this for so long, I can just look at it and say, hey, that's not right. That actually needs to be biopsied or definitely looked at. So we look on the outside here. We also look on the inside here of the vagina. I'm looking for, is there any abnormal discharge that's there? Any abnormal pathology is there? Does the cervix look right? Yes, don't Google because, I mean, don't laugh because yes, this is, you know, kind of, what's the word I'm looking for? I just need to get the word out, so it is a little bit impromptu here, but definitely looking and inspecting this area here, making sure that the cervix looks right, looking for that abnormal discharge, or certainly sometimes you can actually see cervical polyps that are present here. I've even seen, I hate to say it, but I've seen tampons that may have been forgotten in that area, or, you know, other abnormal lesions, like, you know, things that are coming down that should not be there, per se. So again, we're looking to make sure everything's going okay. And then the other thing that we look for is I start to look and actually palpate the area. What I'm looking for there is that I'm actually feeling the uterus here. I'm making sure the uterus feels normal. I'm trying to feel the ovaries. In general, ovaries are small. They're actually hard to feel on some people. So usually if we do feel them if they're enlarged, that's something, you know, that needs to be looked at, an area of concern. Or in case there's any tenderness that's there, that's something else that we look for in this area too. And again, this is just normal anatomy. So again, clitoris is here, vagina's here, I'm so sorry, bladder, I'm so sorry, it's the end of the day, so you gotta forgive me here. The urethra's here, this is the bladder, this is the vagina, cervix area is here, uterus is here, fallopian tubes, and ovary is here, okay? As well as the anus and the rectum. So again, this is something that's just really important for you to know, okay? So again, we reviewed just briefly what is the well woman exam. Definitely know that it is very important for you to do. Make sure that you follow up every 1 to 2 years as needed. Do know that when they talk about guidelines as far as stretching out the pap smears, that's fine for a lot of circumstances, but sometimes, you know, especially if you have a history of a human papillomavirus or a history of abnormal pap smears in general, you do want to make sure that you follow up sooner. In addition, know, and I get this question a lot too, like, hey, Dr. Evans, what happens if I had a hysterectomy? Do I still have to come in for my well woman exams? And the answer is yes. Yes, you do have to still come in. The reason why is because I'm looking for, is there any abnormal breast tissue? And is there anything else that feels abnormal here? Remember, you can still have pathology or abnormal lesions on the vulva or even growing stuff in the vagina that shouldn't be there. So yes, somebody still needs to look down there every so often and just make sure that everything's okay. So again, this is Dr. Kimberly L Evans, just kind of checking in on you. I just wanted to again just review what is up with the well woman exam, and you just take care. Call us if you have any questions. Thank you. Bye-bye.